Our webinar is going to begin in a moment. In the meantime, if you'd like additional healthcare marketing insights, visit us online at smithandjones.com. There you'll find blog posts, white papers, and you can even request a free copy of our book, Under the Influence, the Anthology of Healthcare Marketing Best Practices. We hope you find today's webinar and all these resources of value. Our webinar will begin soon. Thanks. So it says here that you can also see all of our past webinars online. Go to YouTube and search Smith & Jones Healthcare Marketing and see all of our past webinars, including this one. Hi, I'm Paul Fahey, Vice President of Smith & Jones. So our webinar is going to begin in a moment. In the meantime, I thought I'd just put in a quick word for us. So we're Smith & Jones, a healthcare marketing communications firm located in upstate New York. And we support hospitals, health systems, departments of health, really nationwide with a variety of campaigns, including branding, service line, recruitment and retention, and even crisis PR. We'd love to chat with you after the webinar and even during the webinar. Raise your hand, put in a note. We'd love to hear from you. Our webinar will begin in a moment. Thanks. Good afternoon, everybody. Welcome. Thanks for joining us here. I say good afternoon. I should say good morning to our friends, Santa Clarita. I'm looking at you. Thanks for starting your day with us. So we have a number of people watching this on our Webinar Jam platform. This is also being restreamed onto our social media platforms, and it'll be available to watch on demand in the future. So thanks for joining us. Thanks for being here. I'm Paul Fahey, Vice President of Smith & Jones, and we're excited to launch for the 10th year in a row our annual trends report. Here it is. And here it is. This year we have 6 trends. And as many of you know, we produce this every year. We're excited that this is our 10th year in a row. It's produced by myself, my colleagues Lisa Barone, Katie Source, and this is the result of decades of experience that we have, certainly the things that we've had our ear to the ground on over the last year, working with a variety of clients, hospitals, health systems, rural, suburban, urban, um, dealing with a number of different issues that we'll talk about. Um, we also have a team here of more than 55 people on staff. You're not chasing freelancers, but a dedicated team. So the teams that work closely with Lisa, Katie, myself also really help to contribute to a lot of these perspectives. So want to thank my co-authors for this as well. Like I said, we've been doing this since 2010. This is our 10th year anniversary. And it's really that input from our team, email surveys, one-on-one interviews that we've done, focus groups. I think over the last year, we did 40 plus focus groups, hundreds of one-on-one interviews as part of these projects. We've talked to your customers, your donors, your executive team, community partners. All of that kind of helps us, form what we think are important trends to look at in the coming year ahead. A lot of social listening. We look at Google Trends. All of that aggregated here for you. Again, here's a quick glimpse on some of the highlights of the last decade or so. Essentially, the reason we put this out and the reason we do that at this time of the year, not to get ahead of ourselves, we still have a few months left of 2022, some shopping days left until the holidays. But I think it's important for all of us to understand the work that we do is essential as marketers on behalf of our hospitals and health systems, departments of health. But the question is, what are the resources? How can we give back to the community? How can we talk about the trends and the issues that we think are going to be important in the year ahead? So if you're watching this on demand, this was produced and launched on October 6th. So things may change over the coming years. It could be monkeypox. It could be polio for those of us in upstate New York. Who knows what the future has in store for us. But we wanted to put this out and offer some tips and advice in addition to the things that you and your department are probably already doing: service line promotion, branding, a lot of recruitment and retention. But what are the things that you would want to keep an eye on in the coming year, the things you may want to plan for, and as you're going through budget season now, prepare for, allocate some resources. So we'll try to cover this as succinctly as possible, offer some actionable tips and takeaways. And this is really for any size team or budget. This is not dedicated to the lucky ones that have, seven-figure budgets and teams of a few dozen folks. We think a lot of this is scalable as you go throughout the year. And so if you remember last year and the year before that, we launched this trends report. We talk very broadly about this year, our 6 different trends and the things you should be thinking about in 2023. But in the coming weeks and months, we'll also do individual webinars focusing on each of those 6. So in the next several months, you'll see a webinar that focuses singularly on each of those topics. And so we'll take a deeper dive. The things you might skim here, you can certainly, here it is, read about it. This is available on our website. Print copies are going out in the mail. For those old school folks like myself that still like that tactile print experience or whatever. So anyway, you can read about it in more detail and join us in future webinars as we'll take a deeper dive. So with that, the topic sentence, the first page, the opening salvo of this year's trends report simply says there's no turning back. The last several years, and I know everybody talks about, we had this big pandemic and it was crazy over the last few years and we all spent our lives on Zoom. But I don't think many of us have really added up what happened and what happened simultaneously. And more importantly, what was the impact to us, healthcare marketing professionals? This was a global health crisis. This was COVID and all of that for sure. But that led into an economic crisis. There were short-term issues early on in 2020, but that's given rise to now, certainly inflation that we haven't seen since the mid 80s. And so there's some economic challenges, and this is also a global issue. Look what's happening in Great Britain this week with the value of their currency against the US dollar. There were a lot of social issues, civil unrest and things that really helped us move forward as a country, as a people, things that brought us together, and things we still need to work on. And those were happening simultaneously. We had a political crisis. I'm not being partisan here, but it was the most chaotic transfer of power on a national scale that the United States has ever seen. And so, like it or not, there was a political crisis, fueling a lot of that. And really to top it off, and what you'll see us talk about a bit in this trends report is a workforce crisis. And all of these things are interrelated. But when you think about that, you have a global health crisis, an economic crisis, a social crisis, a political crisis, a workforce crisis. That was a lot to deal with. And I think while we may be, and so putting this up on screen, in the past, we talked about COVID narrowly. What's the impact to us in last year's trends report? But this year, Kai Risdall, for those of you that listen to NPR's Marketplace, always says, look, we may be done with the pandemic. The pandemic is not done with us. And there are certainly a number of counties, certainly throughout where I'm broadcasting from in upstate New York, where the numbers are spiking. And what the themes that you'll see and the impact to the moves certainly that employees are making during this era of mass resignation. They've moved on, they've moved over, they've retired, and all of these conditions and forces help to accelerate that. It also helped to accelerate really dramatic changes in the healthcare delivery model, and you'll see us talk about this in a bit. But the things that are happening from big box stores, quite surprisingly, have accelerated, and they're going to give us a bit of a challenge because they're already in our backyard. They're already part of our community, and as they accelerate with a lot more resources than we do, it's something we really need to keep an eye on, and they've made some big moves over the last couple of years. And lastly, to that no going back, this rise in healthcare consumerism has really cemented itself as well. We knew it was coming. We saw it. Gosh, I remember the early days of the internet. We were dealing with WebMD in the late 90s and trying to coach physicians through, yes, you went to school for this and you have your white lab coat and a fabulous degree on the wall. And how dare you, Mr. and Mrs. Consumer Patient, come in with something you printed off of the internet. The internet was even still young then. That was that first shift that we saw, and it was pretty dramatic. And getting folks to embrace it, to understand this could be a very important tool that healthcare providers could embrace. You're thinking about your symptoms, you're typing them in, you're doing the research, you're taking control of your health. Let me meet you where you're at and help guide you through that process. That was the first step. And now, adding in all of that, the cost of high deductible plans now, the rise of high deductible plans have really pushed healthcare consumers into thinking like financial consumers. They want to be cost conscious. They want to know what these expenses are, especially if they're footing some of the bill that they might not have in past generations, which is giving rise to the big box stores and creating all those sort of opportunities. So it's a very interwoven set of issues that we're dealing with and that we'll walk you through. So the first of our 6 trends, we'll talk about that high cost of low morale and what's happening within hospitals and health systems. So let's roll that first video.
One of the big issues in recent months has been the staffing crunch in hospitals right across the country. And we have another example this morning of showing just how bad it is. A hospital in the Toronto area shutting down because of staffing shortages. This is the Lakeridge Health System temporarily closing its intensive care unit at Bowmanville Hospital, moving its patients to other hospitals. Megan Fitzpatrick is at one of those other hospitals. She's in Ajax, that hospital accepting transfers, and Megan is there on the story live for us. Tell us about the situation, Megan.
Yeah, well, that's right, Heather. Lakeridge Health does operate several hospitals in this area of the province east of Toronto, and Bowmanville is one of them. Ajax, Pickering is another. Oshawa is another one. And Lakeridge Health did share the news yesterday that it's closing its intensive care unit at the Bowmanville Hospital and consolidating its critical care services with the hospital behind me and as well as the one in Oshawa. And they are saying this is due to, quote, significant staffing shortages. Part of that statement they put out yesterday says they recognize the impact of this temporary relocation on patients and their families, and this was a decision that was not made lightly. They do say in the statement that they intend to reopen the intensive care unit in Bowmanville as soon as they can when staffing stabilizes and it is safe to do so, Heather, but no clues as to how long that might take.
And so while that clip from Canada, I had no shortage of other clips that we've been collecting over the last year or so. Could have been anywhere in the United States, but wanted to point out, certainly in Canada's market, I think many of you have heard us talk about in the past. We do spend some time in Eastern Canada. This is certainly, this video clip speaks to not only the business impact to staffing shortages. It doesn't necessarily address, what's causing it, and behind that is this high cost of low morale. But the point is, the pandemic asked all of our healthcare providers to step up, and get on those front lines. The amount of burnout, the morale issues that were happening, doing more with less, now doing more, they're strained because their coworkers are leaving, they're either accelerating into retirement, they're moving into other organizations for a number of different reasons. They're not drawing to the profession, so whatever the reasons are that they're leaving, this is costing organizations business, frankly. And it's not what consumers want to see. When they see that on the news, when they hear about that from their neighbors, when they're talking about that, as part of their casual conversation. Look, the healthcare system is complicated enough to navigate. Now you throw me off balance by saying you may or may not be able to deliver things. And frankly, with the attention span of a goldfish that most of us, myself included, have, I think trying to remember which service line was that, so you're not doing a lot of stuff. I'm not even sure if I can count on you for delivering those. So in terms of some of the bullets that you'll see here on screen, closing of service lines or reduced hours for that, and don't think that that story is contained. It'll have a halo effect to the whole organization. Which is then producing adverse impact on patient care. Look, the ratios that the rules say that we have to have between caregivers and patients is what's driving the closures. But the quality of care is what's going to be suffering, and in many cases, and you've heard us talk about this on previous webinars, increased readmissions. You're going to get lower patient satisfaction scores, which means your brand is eroding. And all of that, I think, is affecting the bottom line for any of those institutions. So what can you do about it? And we've talked about this. I think this topic was, I believe, even perhaps the first of our trends report from last year. But looking at and first recognizing there's an issue, whether you believe it or not, make sure that you're listening to your employees. How can you reassign tasks and workloads, for that better balance? Building in that opportunity for regular connection, whether it's supervisor meetings, one-on-ones, town hall meetings. Let them get there in the room, share their feedback, vent their frustrations. Don't be those, folks that are silently resigning also. We as a society have put them in on the front lines. We've asked them to step up. Let's hear how they're doing and make sure that we're recognizing that. And for all that heroism that you've heard us celebrate over the years, rewarding that, recognizing that, is essential. Whether it comes in, simple perks, or more formal celebrations and plaques, or the dessert cart, from dining services rolling up into a department, for whatever the milestone is. All of that I think is critical. So focusing on that overall employee well-being and putting that in the context, recognizing that, yes, you're taking care of your patients, but like that oxygen mask that falls down, in the event of a sudden change in cabin pressure, take care of your people first before you can take care of your patients. If you're not taking care of them, like you saw in this video clip, you're not able to support your patients. So the second trend, and this is related to the first, this concept of zeroing in on recruitment. So yes, one of the challenges is this era of mass resignation, and how do we, recruit folks? Dave, let's roll that second video clip.
We continue to face staffing shortages.
It's a general sense of, we're calling it a bit of restlessness within our own organization and what we see and feel from the staff in the organization.
The healthcare world grappling with staffing shortages. Hospital systems across the Granite State say their employees are feeling the burnout, trying to meet the needs of the community with the limited staff.
They're tired, but they want to do what's right for patients and families and for CMCs.
Dartmouth Hitchcock Medical feeling the same struggles. The COO saying they hired 25% more employees in 2001 compared to 2020, still with a 25% vacancy. Now the hospital system has implemented recruitment programs to bring employees on board. Catholic Medical Center is doing the same.
We're getting groups of people at a time. We're getting 6 or 8 or 10 individuals going through these programs at a time, which is a little bit more quick to, get people into the pipeline instead of maybe one or two per interview, at a time.
Karen Shuck says this is all in addition to the traditional recruitment strategies, not just to fix the problem temporarily, but long term as well.
We've got to help people remember why people go into healthcare in terms of helping others and kind of bringing that back to the forefront.
And CMC says it has internal support opportunities for current employees, like additional education and incentives for employees that refer others to work at CMC. Live in the studio, Marissa Tansino, WMUR News 9.
So WMUR, New Hampshire, covering that neck of the woods, and again, a place we spent a fair amount of time. The clients on the clip are not ours, and they certainly speak about the traditional things that they've done, for recruitment and retention. And we'll talk about and offer some tips and advice on things that we think will be, even more effective. So this assumes you've already identified, compelling drivers and differentiators. You've already thought about why somebody would want to go, work for you versus a competitor. And what we're talking about essentially is basically taking staff from another organization to your organization where perhaps they would be a better fit. There's obviously a lot of other pipeline strategies, partnerships within colleges and feeder schools that could help run. So maybe you're running the ads and not getting the form fills and phone calls and the resumes that you were hoping. So in this next part, in the second trend, the concept of zeroing in on recruitment speaks to really targeting this old saying about media, the right people, the right place at the right time. And so one of the things, and I think we've talked about this on some of our previous webinars, a reporter named Chris Ingraham from the Washington Post, it was about 10 years ago, he looked and created something called Google's Misery Index. It is the index of all keywords related to misery, pain, suffering, stress, anxiety, etc., and started to plot those out through Google Trends, a tool we've mentioned before, free tool, fascinating tool, to get a sense of when are people, to this headline, the most depressed, anxious, and stressed. And we've started to overlay that into how they feel about their jobs. And so the first bullet here speaks to the concept of commuter advertising. Yes, you can run your ads, and put things out there. You can choose different media types that raise awareness. And every media rep will tell you they've got a lot of great impressions, et cetera. How can you then, make a more surgical, pardon the pun, approach to your media buying that targets the people when they're in this mindset? And so as I bring you through that sort of logic flow, when during the day and what days of the week, what times of the day do you think people like their job the least? Well, it's during their commute and typically earlier in the week. Maybe that concept of Sunday scaries when you think about the week ahead. But Monday, Tuesday, Wednesday morning, when you're on your way or afternoon on your way to a shift, is pretty much when you hate your job the most. Yes, you might have a set of impressions at the end of the day and it all sort of wraps up, but that concept of getting somebody in that mindset when they're headed toward their job, and that mix of, and again, you can read more about this in our trends report, combination of commuter media. We love radio and we love out-of-home advertising. So radio, and in particular, you rural markets, are really still going very strong on terrestrial radio. Suburban markets, streaming platforms like Spotify and Pandora are great. This is how people are consuming content on their way to their jobs. Out of home, and that could be billboards, it could be subway advertising, bus shelters. That mix is particularly powerful. And if you can target it, through digital billboards early in the week, at times when people are commuting into their shifts, that's when you're going to reach them at that right place, that right time, in that right mindset. The other concept is geo-poaching. So if you're familiar with geofencing, essentially drawing those invisible circles around your competitors' campuses and serving up those, ads to them. If you've ever walked by a break room, that's filled with employees, what are they doing? They're here. They're on their phones. They're just checking in. What a perfect time to reach them with a message about opportunities at your organization. So again, it's taking things that you may already be doing, but putting them, in that ability to reach the right people, the right time, and with that right message. So our third trend, using data to fuel growth. We, as I've mentioned before, we have a pretty robust team here, a little north of 50 people. We are a data-driven organization, and believe me, when times are tight, and they are, and when you're going through economic challenges, and you are, this is when the trustees are asking about that dollar I gave you to spend. What did I get back? Their reliance on your dashboards and the data is essential. And to that end, looking at how we can embrace growth marketing, things that are commonplace in other organizations. We cross-pollinate from home service organizations, whether it's landscaping, pest control, pool installation. Our parent company over it has a whole team that's dedicated to those service lines for those types of retailers that live and die based on their ability to keep their technicians busy. Their trucks are rolling, they're not sitting in the parking lots. Cross-pollinating that growth marketing and bringing that into a whole different data set where you can start to go beyond A/B testing, where you can start to look at customization of messages, where you can look at developing automation sequences to nurture folks through, to make it personal. When you have a contact that's in your database, and this is particularly easy for many of you that are on, say, Salesforce, and you're using Salesforce Health Marketing Cloud. This is the opportunity to look at that. What content are they engaging? Don't assume, and we talk about this in our report, that they found what they were looking for, that they know what they're there to do. But if you can look at those digital and look at that data to get a sense of the content they're consuming, their engagement with your email marketing, starting that texting strategy. And that's one of the things that, while we wonder what's happening to our direct mail and we see 2, 5, 10, 20% open rates on our email, 95% is typically the open rate for text, strategies as well. All of that produces a lot of data. And as you've heard us say before, compared to social media, we're not saying abandon social media, but compared to social media, there's a tremendous opportunity. Now you own these contacts. If they're engaging with you via email and text, if they're visiting your website, and you have all of that data, those nurture sequences, you can start to push them through the funnel. And again, it's in the report in a little bit more detail, and it'll definitely be a topic of a future conversation. Your business, your CFO, your C-suite will start to give you those cues in the next few months. What are the service lines that we want to see for 2023? What do we want to see that's underperforming, that we believe we should be gaining more market share, that's underutilized, whatever it is. So you're going to have that data to know what to deploy to begin with. Then I think deciding which platforms to use based on those performance and activities. So whether it's going to be, automation sequences, social engagement, email marketing, texting, anything else like that. Within all of that, those are just the tools to deliver the message. It's that content strategy. So what are those service lines? What platforms do you need to use? What's the right content for each platform, and how, and you'll see us, very often. Video is the most engaged content on social media. It's what gets clicked on more often on email marketing. The promise of a brief video or even an interesting infographic, all of that content is going to be king, wrapped up into those different marketing tactics that I was describing. And all of that can roll up into your dashboards for nice, tidy little board of trustee reports for you. So, and again, keeping that first party data, there are changes to a lot of the technology. This is something that we talked about in last year's. If Facebook were to go away, the investments you've made in your social media, and the relationships you've built there, the community that's there, engaging or disengaged as they might be, they would still all go away. Pushing them into your CRM, collecting that information, the contact information through email, texting, all of that other data is going to be essential, and certainly something we want to see make investments on in 2023. Okay, so the fourth trend, and this is the one I think that we've been paying a lot of attention to over certainly the last year and over the last several years. And I believe this, combination of crises has forced the acceleration of all of this. Dave, let's roll the video first for context, and then we'll chat about it a little bit more.
In September 2019, the retail giant known for its everyday low prices launched Walmart Health, a primary care clinic at a supercenter in Dallas, Georgia. The doctor-run clinic, the first of its kind for the big box retailer, offers services like x-rays, annual checkups, and dental exams. With 15 Walmart Health locations up and running as of December 2020, the company announced plans to add at least 7 more by the end of 2021. As consumers face skyrocketing healthcare costs, Walmart, along with its rivals, CVS Health and Walgreens, are diving deeper into the healthcare business, opening in-store clinics in an attempt to grab a slice of the $3.6 trillion Americans spend annually on healthcare. But analysts say Walmart faces several hurdles in its quest to scale up nationally with a roster of highly paid doctors and dentists.
Healthcare is notoriously complex. If you think about the delivery of care, there's so much of a personal touch that's required, and it doesn't lend itself to Walmart-style efficiencies. So there's always been skepticism about Walmart's ability to deliver that high-quality care experience, never mind profitably, and never mind at a national scale.
So again, I'm old enough now to remember when we were first challenged by these emerging physician freestanding clinics. All of a sudden they started buying MRIs and they were starting to provide services. And if you're in a state like New York that requires a CON, were they bypassing those? Were there policies that allowed them to sort of take some of our market share? Now, and I think what's been accelerating over the last several years is the rise of consumer presence within these retail models. So your CVS, Walgreens, Amazons, all of them are looking at, the opportunity within the healthcare marketplace. They understand that consumers are becoming much, much more cost conscious, as I said at the beginning of the webinar, and developing a deeper dive into that, providing primary care services, urgent care services. This goes beyond just flu shots that they have done in the past. A lot of these are services that you may or may not be providing. If you're a tertiary, clinic, a level 1 trauma, they're certainly not going to be competing for it. But those long-term relationships and that feeder entry into your organization now is where we're starting to see a lot more of that competition. Amazon Care Medical, their CEO that was hired earlier this year, basically just said, I get it. I was a burnt out physician. I understood the challenges of the healthcare system. I'm willing to bring this in. I want to help this organization scale up the access to care, and in particular, all the products and services that go around it. And here's a name, Google it, Dr. Albert Wu, standard spelling. Dr. Albert Wu was hired, I think, a little less than a year ago. He is the chief medical officer for Dollar General. So if you don't think that Amazon belongs in this space, Dollar General with their 20,000 stores nationwide, again, this is the place we go to for inexpensive cereal and gift wrapping and children's toys. And yet their stock, the fact that they hired somebody, with as rich a background as he has, is truly remarkable. And I think those are the signals, now we're fighting on multiple fronts. To my earlier point on this trend, we used to be, fighting hospital versus hospital and competing against each other for market share or a better way of delivering care. Then it became those freestanding physician clinics, and now it's this massive retail movement. And what really scares me about this is the last couple of years have weakened the revenue streams for a lot of hospital and health systems. Yes, we're still nonprofit. We have a little bit of a leg up there, perhaps, but we don't have the resources that Amazon does, that Dollar General does to make these investments in that care. And so, yes, the competition's fierce. It's unrecognizable. What can we do about it? And again, we talk about this briefly in our trends report. This will definitely be its own standalone topic. In fact, I see us going beyond an hour for this one because I think it's fascinating, the trend in this, the shift in this. But certainly, in the video clip alluded to this, you have that local advantage. You're already a respected member of the community. The public, healthcare consumers, your patients, they want to believe in you. They want to support you. They want to be proud of your brand in particular. Certainly that puts a big challenge, I think, as the person was speaking in the video clip a moment ago. Their ability to scale up something on a national level or a regional level is going to be very, very challenging. And so they're going to start to do the generic types of messaging, the stock images, the cliches, and there's a stronger opportunity. I think your brands are already deeper entrenched. You have that sense of local authority. You have community-based programming and support. You do the local sponsorships that you do within community partners or other sort of community organizations. And ultimately, And I think we've said this before. We've said it at the introduction of our book, and I think it's even here in the introduction of our trends report. It all comes down to brand. And I think investments in 2023, making investments, setting aside money in your budget to just carve out that, brand investment. Not saying rebrand necessarily your organization, but what are those differentiators? What makes you different and special? Where are you that concept of neighbors taking care of neighbors, casting doubt and fear about these interlopers stepping into the space that they may or may not belong. But it's certainly, they're well-resourced. They've already told us they're coming, and I think we need to be prepared for it. So stay tuned for this trend report as well in the coming months. So winning social proof, what do we mean by that? Not a new concept. It's been around since the mid-'80s, and we cite that source in our trends report. This idea of third-party validation. What does everybody think about it? What is everybody doing about it? We go to restaurants because strangers we've never met gave it a higher rating on Yelp than somebody else. And even healthcare is being driven by, the review platforms. You'll see people sort of crowdsource, hey, everybody, can somebody recommend a good, thus and such. And so we have access like we've never had before. And we know that a lot of people are seeking, information. We're doing that research on social media. 80% of us are buying brands that somebody recommended on social media that we saw. We're reading those online reviews, and we're asking folks, about every aspect of our lives. And so investments in those social platforms, I think paying attention to the reviews, having somebody on your staff that's monitoring those, that's responding to those is essential. Beyond the reviews and testimonials, the earned media that you can get through public relations. Again, I think that's a place for your trusted authority, your trusted content, that'll help build your brand to the earlier point. But when people read something in the news, they're less skeptical about it than they would be, say, in advertising. Influencers, brand partnerships. How can you start to affiliate with not necessarily the larger feeder, big city brands, but even other community partners? Who in your community can you start to feature? How can you look at the data that's there? Again, as we talked about that earlier trend, there's a tremendous amount of data that's in social media that you can harvest, that you can use to help, inform how people are being influenced. The awards and recognition, those third-party awards and recognition, again, it speaks to that validation. Many people, it's not high on the list. When we go into focus groups and we say, what matters? Why would you think this hospital has a better reputation than that hospital for a service line? It still comes down to, surprisingly, timely access to appointments, bedside manner. We have to probe to get into latest technology and degrees and things like that. But there is a place for those awards and recognition. And if the community is celebrating it, I think there's an opportunity there to support this concept of social proof. And again, user-generated content. If there are people in your community that are, proudly sharing videos of a recovery or of a milestone or of a birth, and attributing that success to you, helping to highlight and celebrate that is incredibly powerful. And again, it goes to those proof points that we often discuss. I think many of you that have either worked with us or heard us talk about developing your brand, we have not only those claims, the taglines, the positioning statements, but we dive into those proof points in much the same way. Those proof points are what folks are looking for from their healthcare provider to help make decisions. And again, you're deeper entrenched, you're already connected with your community, going back to the competition from the big box stores. All right, so we have one more trend left, virtual reality, virtual delivery of healthcare. Just a piece of the puzzle, and certainly the trend of telemedicine is waning from what it was in late 2020, early 2021. Dave, let's roll this video first, and then we'll just chat briefly about it.
If you end up here, it can be stressful, a hospital bed, and not just because your health is in jeopardy. It's an unfamiliar place with unfamiliar people. It'd be nice if you could just get the care you need here, in your own bed. That's the idea behind the very first virtual hospital. The creator said he was inspired by his mother's illness.
When I was 7, she was struggling one day, and I found the courage to pick up the phone I found the number of our physician and called him and actually convinced him to come to the house. She was, in a lot of pain. When he came into the home, there was this extraordinary moment where peace came over her face, and it was like somebody injected her with morphine the moment she saw him.
That's Richard Rakowski. He calls it medically home. A kit shows up in the mail, allowing doctors to remotely have real-time access to your vitals, all from the comfort of your home. He says centralizing the patients also keeps germs from spreading and reduces the risk of falling. No doubt it'll also be cheaper.
65% of the cost of care is overhead, fixed overhead. It's not doctors, it's not medicine. If you do simple math, you only have 35% left to actually deliver medical care.
Medically Home is only available in Boston and Indiana right now, but Rakowski says he'll soon share plans to get the product in all 50 states.
So there's a lot to unpack there, and I want to talk about two things related to this concept of more than just virtual. We certainly could have put this movement, whether they're home kits or your Apple Watch, which I'm not wearing right now. There's a number of devices that are pushing healthcare delivery, or at least healthcare information, into the hands of consumers, into the household. This is a whole other dimension. So what you saw here, and the company that's based on, or anything similar to that, certainly has massive potential, A, because of the acceleration of telemedicine and virtual delivery, but B, when you think about it, what is the largest hotel or temporary housing organization on the planet? It's Airbnb, and it doesn't own a single property. What is the largest transportation organization on the planet? Uber, Lyft, doesn't own a single vehicle. And so organizations that don't have a single bricks and mortar presence, whether it's the big box or the traditional hospitals or physician groups, can start to push that in. We're seeing it in mental health. We're seeing it now with the advent of these services. Needs to gain a little bit of traction. I don't know that I would put a ton of money on my budget for 2021 or 2023, rather, to really combat it. But I think it speaks to that concept that virtual is emerging as not only a competition, but as I mentioned at the beginning of this, we know that engagement on telemedicine has gone down a bit. We weren't in quarantine, we weren't locked down as much as we were. And so, with that in mind, recognize that maybe it's okay to start pulling back on that a little bit. Offering it as an option is incredibly helpful, especially if there's a sense of urgency, you're in a rural area. But don't push people, especially those that are in vulnerable states, into telehealth. As you've heard us say before, people are off balance very often. Yes, there are wonderful moments and things to celebrate in the healthcare setting, but very often they don't understand how to navigate it. They're sick, they're injured, they're ill, and they're vulnerable. Only limiting that or driving that to telehealth, can be a bit of a challenge. And we're starting to hear from some of our clients that, they're getting a bit of patient resistance to it. And they're certainly, in the context of Zoom fatigue, and thank you for watching it, those of you those of you that have Zoom fatigue. Is it even, better in general, for younger audiences? Yes. Older audiences, maybe not. Keeping that in mind as you're starting to promote different ways to access and engage with your patients. But all in all, make sure that there's always that option to, click and ask for a representative or whatever it is. But the option to connect with real people, understanding that they may be more comfortable dealing face to face, wherever possible. And so all of that, seeing your practice through these consumer, eyes, we intentionally kept this from last year. We understand the dramatic changes that are happening, and I can't wait to go watch this video 10 years from now and just see, how far the industry has come as quickly as it will. We don't have that luxury of the captive audiences referred from, the single set of referring physicians. Patients are changing the rules, and other organizations, retailers, much better resourced than we are jumping in and forcing us to adapt. So, keep that eye on your brand, think about your brand, think about the year ahead, measure that, go to Google, type in your organization's name, look at your ratings, look at your rankings, and get a sense of how your brand, can coexist not only with this, change in competitors. Are you speaking to and reaching and resonating with this changing consumer? And if not, we'd love to be a resource and chat with you. We're very generous with our first hour, so would love to hear what's keeping you up at night. So thanks. Those were our 6 trends. As I mentioned, you're going to hear from us in the coming weeks and months. We're going to dive deeper, into each one of these as its own standalone webinar. But we thought we'd give you that sense of, in addition to all the things you're already thinking about for 2023, where do we see, the opportunity to make investments to better strengthen your organization. So, thank you for joining us today. For those of you in the Northeast that are already members of NESHCO, I'll be presenting on October 18th on the topic of crisis PR and a very practical set of tips to protect your organization during any type of downturn, whether it's the broader issues we were talking about at the beginning of today's webinar or something much more acute. We'll kind of walk through some of the basics, how to identify a crisis, how to manage and respond appropriately through that as well. So join us if you're able to. It's open beyond NESHCO members to other folks in the public. I think there's a very, very small fee. So hope you can join us for that. So thank you. And on behalf of Lisa, Katie, and myself, thanks for joining us today. Thanks for watching this on demand in the future. Enjoy the rest of your day. And Dave, I am out of here.